Good morning, everyone. And this and come to Turkey, and I think I will never have enough good time here, and amazing food, and also amazing hospitality. So, and I hope that I'll be having more opportunities to come and to communicate with all of you. So, my name is Yanbo, as Dr. Ximin Li said, and I'm a psychiatrist as well as a researcher. So I easily get bored. So that's why I want to do something new and something interesting. So every year I want to just introducing something that may be inspire you and also as well as myself. Okay, so this year I want to introduce something that's pretty new, pretty interesting called digital therapeutics. I don't know how many of you ever have heard about it. So if not, let's just figure out all together. So, okay, just my conflict of interest. And so let's see. So I would like to cover this following objectives. What is therapeutic or digital therapeutics? And how it's different from the mobile apps that we all have, and also the traditional medications. And I want to just do some demonstration of the current available digital therapeutics for addiction and also for mental health. And the last one, I really want to discuss with all of you to think how this new thing will change our clinical practice, our medical education and research, how this will change the directions of psychiatry and for the future. Especially that's because the challenge, the topic here is very relevant, is the post pandemic, and the pandemic really changed our concept, ideas, and our behaviors. So yeah, so digital therapeutics ultimately is a program, is an app or software on your cell phone or on your computer. It's not a physical pill or physical medication. So it's a software, and the purpose of the software is to deliver patient interventions, to treat, to manage, or to prevent a disease or disorder. So it can be used independently, or it can be used in combination with medications or other therapies to optimize the treatment care and also the health outcomes. So it sounds familiar, right? Because before we all have cell phones, we will do something else similar like this, like a psychotherapy. But now, if we can think about this, this is more like a psychotherapy on your cell phone. And like a video game, give you reward, give you a promotion, give you interactions that make you feel that's less boring or less redundant and annoying that when you do it. So that's a different way to deliver our old approach. I would say that this is a new bottle with some old wine inside. So, but the bottle itself is really appealing, and the commercially, we all want to buy something based on their package. So I guess that's not a bad idea. So this table helped us understand what's like compared to other things. As I mentioned, digital therapeutics is not like the common apps we see. You probably everyone here probably have the one or two apps on your phone to improve your brain functions, to get better with your mental health conditions. But none of them actually has been proved or been tested using the modern scientific approach. So digital therapeutics is different. It has to go through a very vigorous test, like any other medications that before they can be on the market, using randomized control. And also it has to be approved and also be assessed by the regulatory bodies like FDA like any other countries that they have the specialized department and to prove medication or not. So that means it set a very high standard bar and to get this one being called as digital therapeutics. So what we know that the digital health has been a really big topic, as Dr. Cao said, and from machine learning to virtual reality. But where is the digital therapeutics located? It's quite in the center because it's very important in direct interaction, the direct phase with the patient's care. Like see, we all probably have some experiences in the past with telemedicine and with a health record system and with remote monitoring. But most of them only cover a certain part of the digital therapeutics. And digital therapeutics is more like covering the very center of this and combined all the different components from monitoring to interactions through the app itself system and to deliver the outcome or deliver the treatment directly. So, by this estimation, say what this areas, the value are going to be. And currently it's like $9 billion as estimated. But with the time, it's going to be dramatically increased. And there's just some logos of the new companies that are emerging and coming into the market. I only list those companies that are from the Western world. But actually that's almost as much as this coming from China at this moment. And also Turkish language is ranked like top 5 and in the market at this moment. It's very surprising, especially that if we think about Arabic and Spanish and English have much more population to speak. So that means the opportunity for our community here, and it's rare, unique, and also it's very active. So second one make us very exciting is finally mental health and psychiatry become the pioneer, and after years of us being always 50 years behind the rest of medicine. So at this moment, psychiatry almost dominated the digital therapeutics market and the development. And if we combine addiction, it's more like we're the leading party and in this new revolution. So how does digital therapeutic deliver this treatment? Actually, we're all familiar with that. It just suddenly, and we use a different platform to deliver it. You can see everybody probably will be very familiar with like thought, emotion, and behavior. It's a cognitive behavior therapy concept. So, but the the CBT concept has been used and not only to treat mental health conditions, but also used to help to manage the chronic conditions like diabetes and hypertension and other internal medicine conditions. It's because there's a lot of interactions between our mind and our physical conditions as well as our behaviors. And those chronic conditions, probably at least 50% of their outcome lies with their behavior change. How do you control your diet? How do you make sure that you have regular physical activities? So that is why cognitive behavior therapy has go above and beyond our mental health treatment. And this is a primary principle behind the treatment, the digital therapeutics. But of course, there's some other component I will introduce. So overall, it's the digital part provides us opportunity to have a mobile doctor and also life coach and with us 24 hours, help the reminders, give us encouragement, and to make us feel that we're on the track. So that's kind of like a concept that we're trying to do. So now I want to just introduce one this is the first one that's being approved by FDA. All the digital therapeutics need prescription from doctors. And can you hear me? Okay, so this one is actually the first one has been approved by FDA, but by far there's over 50 different digital therapeutics has been approved. And in Canada, not in Canada now, but in the States, in Germany, in Belgium, and all the digital therapeutics has been incorporated into their health plan. So that means it can be reimbursed, and it's also been paid by the payers. So this is one that's based on the CBT model for addiction treatment. They have several versions, and such as they have called a reset version, and specifically for substance use disorder. And they also have another version for opioid use disorder, because opioid disorder is harder to treat and it's more challenging. So they use it as adjunct treatment with the replacement treatment that we normally do, and using metformin, using methadone or using buprenorphine. So surprisingly, just by adding this cell phone app, and it can help to increase the retention rate of opioid use disorder by 15%, which is amazing because around 50% of people who's on the maintenance therapy, such like buprenorphine or methadone, will drop off the treatment in 1 year. So increasing by 50% by just adding a software, it's pretty impressive, and also from safety and also from cost perspective, it's definitely something that's worth of discovering and worth of promoting. So there's another, as I mentioned, that one was based on CBT model. But there's another one that's slightly different, but it's very interesting, and is the ADHD one. So this is from Aquilia. It's a company that they developed called Endeavor. Endeavor is a software that's matched with, it's more like a game, and matched with age-appropriate stimulations with kids. So by using that, and they actually can significantly help kids' concentration and their school attention performance, as well as their reading abilities, without using medication. So by using this one, and they already achieved even a long-lasting approach, long-lasting benefit for the patient with ADHD. So we know that's how challenging that we want the kids to be on medication. The parents were worried about how it impacts their physical health, how this one potentially become addicted. Even that a lot of them are not correct information, but persuading and promoting patient to be on medication is still a challenge thing. So if we can avoid using medication, or use medication, or use other things to reduce medication use, and it will be a great opportunity for people to start on the treatment for ADHD to prevent their long-term adverse benefit, adverse outcomes. So this is a really interesting thing to discover. But at the time when I just saw this one, my next question was, okay, so if this one can improve the cognitive component, it might be able to use for other conditions. So they did something, and after this, so they use the same program but modified a little bit to the adult population, and they use them to test whether it can help patients with major depressive disorder, but focus on their cognitive deficit. We know that current medication as an antidepressant most of them, like 99% of them, not really focused on cognitive deficit. Even when patients are symptom-free from depression perspective, cognitive impairment is still an issue, and it's actually the major one for patients on disability. So using the same concept as mind training or brain training, and it can significantly help the patient to improve their cognitive function in the patient with major depressive disorder. So this is why I think it's very, very important for clinicians to understand and to know that what's the development here, what kind of thing available, how can we combine and use the new technology to help our populations. So before I finish this, I just want to talk about, as we're embracing a new era, especially that's post-COVID. Before that, we all believe psychiatrists need to see the patient in person and to have the human connections. We need to have the eye contact. We need to know our patient in certain level so we can deliver the therapy. But COVID has changed all the concept. We can do Zoom, and the patient feel not much differences. And that's opened a door for us to look at what are the things we can do, what are the things we have missed. So one of them here is how much we focus on the basic part of their life. And I really like this new guideline that's from 2020 from New Zealand and Australia Society of Psychiatry or College of Psychiatry. So because they, for the first time in all the guidelines, and we put the actions as a mandatory part for physicians to promote and to modulate and to support our patients' behavior change, from sleep to regular exercises, to diet, to the medication habit, how we take that, quit smoking, and control our alcohol and other substance use, and to focus on the cognitive functions, education, the social functions, all of that together. And before we move on to tell which medication is more useful, which ECT or RTMS will be more useful. So I think this fits very well with the digital therapeutics concept. Is we start to focus on patient's basic need and also give the patient back their control from practice and also from medical education perspective, because I'm also the program director for the residency training in our university, and we always, this flower on the right side is kind of a concept for the lifelong medical education from Canada, from a medical student to professor. Everybody need to really reflect on what they're doing, how they become a good physician, from being just a medical expert to a good communicator and good advocate and good educator or a good scholar. So actually the digital therapeutics actually helped us to extend our roles and to the patient and become, it's much easier for us to use them to do the education part. And it's much easier for us to become the collaborators through the modern technology. So I would say, if it's not available to have the digital therapeutics on this market, but we can still think about other apps. And I used to call my patient to say, the first thing come to my office, show me your pace, how many steps you did, how many physical activity you did. At the very beginning, they're very reluctant. And they have to show me and before anything starts, because they're so proud of what they've done, and they want to share that with me. I think it's very important to give them a power and to have their good self-management and also decision-making part. So that's why what I'm here, what I think that digital therapeutics is not only just a product. It helped us and also help our patient to change the mindset, to see how can we work together to get a better opportunity, to make things better for them. And this at least a few things here.